Okay, so now I'm going to inspect your head. I can see that she's normocephalic. She doesn't have any lumps, any lesions. Her face is symmetrical, which is that she has a good cranial nerve number 7. I'm going to palpate your temporal artery. Let me auscultate it really quick. Okay, she doesn't have any bruits. So I'm going to palpate your temporomandibular joint. Can you open your mouth? Close. Again. Okay. So she doesn't have any clicks, any decreased range of motion. I'm going to check your sinuses, and you're going to tell me if you feel any pain when I press. Any pain?
No.
Okay. Okay, so I'm going to inspect your ears. I can see that they don't present any abnormality, any lesion, any discharge. They are in good alignment. I'm going to use the otoscope, so I can see the other side. She's an adult, so we're going to move up and downwards. Okay, I can see that the patient tympanic membrane is pearly gray, which is normal. No signs of inflammation or infection. I'm going to assess your hearing. I need you to cover one ear with your finger, and I'm going to whisper something, and you're gonna tell me what I'm telling you.
ABC.
Now with the cover the other. 1, 2, 3.
1, 2, 3.
Okay, perfect. So now I'm going to do the Vena test. You're gonna tell me when you hear the sound. Okay. So I need you to look into the distance. Look into the distance. Into the distance. Now I need to assess accommodation. You have to follow the pen. Perfect. She has good accommodation. So I'm going to darken the room. For the purpose of the video, I'm going to use this tool as a scope, and I'm going to observe your eyes. So I can observe the orange glow in pupil as well as red reflex from retina, which is in the normal limits. So now I'm gonna check your nose. can see the anterior and inferior surfaces of the nose, which is are in the normal limits. So I'm going to assess your mouth now. Okay, I can see that the patient lips are symmetric. I need you to open your mouth. Okay, I don't see any abnormalities in hard and soft palate, buccal mucosa, gingiva, and tongue. I'm going to start with the auricular lymph node, postauricular, occipital, submental, cervical, and the supraclavicular lymph nodes. Okay, excellent. Relax your necks, place your necks slightly forward. Okay, I'm going to assess your trachea. Okay, the trachea is in midline, no deviations. I'm going to inspect your carotid arteries. Okay, I'm going to palpate both carotid pulses. Let me auscultate for bruits. I'm going to check now your thyroid. Fold your head back. I'm going to palpate your thyroid gland. Any mass is noted. Okay, flex your neck forward. Forward. Palpate the isthmus. Okay. I need you to swallow water. Okay. Perfect. And now I'm gonna check your range of motion. I need you to move your neck up and down and to the sides. Okay. I need you to train your shoulders. Okay. Now I need you to train your shoulders against my resistance. Okay, good. Now I need you to move to the side against my resistance. Okay, now this way. Good. I just checked cranial nerve number 11, and it's normally fine. Now I'm checking your you have normal respirations, regular rhythm, normal effort, no cyanosis, no clubbing, it looks symmetrical, no scars, no lesions, no lumps. So I'm going to palpate your lower thoracic expansion, breathe in and out. So I'm going to assess for parameters. I need you to say 99,
99, 99, 99, 99.
Perfect. So I'm going to percuss measure this way. I'm measuring and assessing for diaphragmatic excursion. Now I'm going to auscultate your lungs. Breathe in and out for me, please. Good. Now I'm going to assess your chest. I can see that breath are symmetrical, no scars, no lesions. Try your hands for me, please. Okay. Now place both hands in waist. Press your elbows forward. Okay. On palpation, you can see there is no lumps. Okay, I'm going to assess your parameters. I'm going to say 99 for me, please.
99. 99.
Okay. I'm going to percuss your anterior lung fields. Okay, perfect. Okay, now I'm going to palpate the apical pulse. I'm going to auscultate. Good. Now,
So just please say blue moon.
blue moon,
Again.
blue moon,
And then I'm actually going to do one more.
blue moon.
Okay, so vibrations are equal on both sides. Go to posterior. Again, say blue moon for me.
Blue moon, blue moon,
Again,
blue moon,
again,
blue moon,
again.
blue moon.
Okay, vibrations were equal on both sides. So then I would go on to percussion. So in percussion, there are 9 points that I need to do on the back. On the shoulder area, there are 3 points that you could choose from, but I'm just going to do the first one. So I go, we're assessing for any resonance. Then we go, seeing if they're equal on both sides. So I am seeing or hearing a hollow sound. So that's 3. You ended up going down to the 7th point, and then 8 and 9 are on the sides. I would check on the anterior. So again, there are 5 spots. So again, checking to see if I hear any resonance. And again, I did 3. There are 5 spots. I wouldn't do it over breast tissue just because, again, sometimes the sound. Take a break, just let me know. Breathe. Again. Again. So I'm hearing mostly vestibular sounds. Like I said, there are 5. I'm only going to go do 2 just for the purposes of this video. Then I would check the back, again, using the 9 spots for auscultation, or auscultation and percussion. So I would start here, breathe. 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 hearing mostly vestibular sounds, as I said, you would go down to the 7th spot, and then 8 and 9 are on the sides. So next would be the cardiac area for a full cardiac assessment. I would start on the right side, which is aortic, which is on the 2nd intercostal space. Then on the left side is when you start pulmonic on the 2nd intercostal space. Go down to 3rd, which is Erb's point, 4th, which is tricuspid, and then 5th, which is mitral. Then I would do this on the temporal, the carotid, the apical, brachial, radial ulnar, femoral, popliteal, posterior tibial, or pedal. So for the purposes of this video, I'm only going to choose 2, so I'm going to do your carotid, okay? And at the same time, I'm assessing for edema as well as temperature. So no signs of edema, pulse appear to be same on both sides, and your temperature is warm. So is it okay if I do your pedal next? Is it okay if I take off your socks? Yes. We can put them back on after. Next. So then I would check your pedal pulse. Again, assessing for edema as well as temperature. Okay, pulses are even on both sides, no presence of edema, and temperature is warm. Next, I would check capillary refill. So I'm gonna press on your toes here. Okay, refill is less than 2 seconds. Can I have your nails, please? In theory, your capillary refill should be less than 2 seconds, but because you have nails, I can't really assess for that. Next, then I would go on to the neurovascular assessment. So your color of your feet and your hands appear to be similar in color to the rest of your body from what I can tell. I already checked your pedal pulse. Do you experience any pain, numbness, or tingling in either your fingers or your toes?
No.
Okay. Can you have your feet hang for a second and then move them side to side? Okay, so you have good movement, so there's no presence of paralysis. So that ends the neurovascular assessment and the 5 Ps. Next, we would go on to an abdominal assessment. So if you could please go over to the bed over there. Put these on. So about 5 to 30 bowel sounds per minute is typical. We have a bowel sound there. Like I said, we'll be doing this in each quadrant. If I didn't hear a sound, I would have to auscultate for 5 minutes per quadrant for a total of a 20-minute assessment. So listen. So after I auscultate, I would then percuss. So in this way, I actually like to think of the stomach as a tic-tac-toe board for 9 different quadrants, and I would make sure that I stay away from the umbilicus by at least 2 inches on all sides. When I'm doing this, I am listening to hear if I hear any tympanic sounds, which is more like air sounds, or any type of dull sounds, which could be due to either fluid or food or potentially masses or tumors. So again, you would do that in each of the 4 quadrants. Just a light tap here. Hear that, how that one was kind of dull compared to the first? Okay, walk over in that direction and then walk back towards me just normally. arms are swinging at her side, head is looking forward, doesn't appear as if she's limping or shuffling in any way, joints appear to be symmetrical, and extremity length is appropriate for your age. Then I would start to assess for curvature of your spine, but can you please first put your hands on your hips? Okay, so it appears as if your hips are level, so if you could turn this way, please. So first I'm going to look at the curvature of your spine. So while you're standing, I'm going to run 2 fingers down the middle of your spine to see if I can assess for any atypical curvature. I'm also going to do this while you're bending over. So if you can bend over for me, please. Just have your hands hang. Okay. Again, assess for any curvature. It doesn't appear as if there's any atypical curvature at this moment. Then I put my hands here. Just rise up very slowly, okay? Scapula and spine are symmetrical upon rising. No atypical or unusual joint movement and no nodules are present. After this, we would assess for range of motion of the joints as well as for any pain. So you can do this in your neck, shoulders, elbows, hands, wrists, fingers, hips, knees, ankles, foot, toes, or your TMJ. So for this video, we're going to pick 2. So we're going to look at your shoulders, okay? So just follow my movements and we're just going to see what your range of motion is and if you have any pain. So just lift your arms up, flip, up, flip outwards, go back down. Then we're going to do a little circle. Okay, back down. Do you feel any pain? So it seems like you have full range of motion. So then next I'm going to do your knees.
We'll start with the upper extremity. First, I'm just going to look at the patient's arms here, noting any skin discoloration, also looking at muscle tone on each arm, and then hair patterns as well, also looking for any scars or lesions of the arm. And next I'll have you hold your arms up for me, patient. Thank you. And then I'm going to check for temperature. So I'm just going to run my hands along your arms. I'm looking for any warmth or hotness or cold along the arms, whether that be on one side or both. So that's good. Then next, I'll have you put your hands over again. We'll do the nail compression test. So I'm just going to compress one of the nails here on one side, hold it for a few seconds, and release. We're going to look for blood to flush back into the nails, which it does. Also check the other side here. Good. And then we'll do the hydration test. So I'm just going to have the patient's hand here. I'm going to pull up the dorsum part of their hand, release. There's no tenting, so that means they are hydrated. The other side. Good. All right. Next, we'll do the pulses. So I'll have you flip your hands over for me. Let them rest on your thigh. Good. First, we'll do the radial pulse. I'm going to perform bilaterally. My fingertips here, feeling for both sides, noting rate, rhythm, and amplitude, making sure they're the same on both sides as well. Good. Ulnar pulse. Good. And then we'll do the brachial pulse, which is just medial to the biceps tendon. Good. Test the other side here. And that's good as well. All right. So next, I'll have you slide over just a little bit. We're going to check for lymph nodes. So I'll have you put your arm on my shoulder here. First one, we'll do the anterior lymph node, which is just behind the pec muscle in the armpit. So are you ticklish at all?
No, I'm not.
Okay. Feeling for any nodules here. Do not. Then we'll do the medial, which is in the thoracic cage here in the armpit. Feels good. Then we'll do lateral, which is on the humerus. Good. and then posterior, which is just in front of the subscap muscle here. Good. And I will perform that on the other side as well, along with the epitrochlear lymph node. So I'm going to grab the patient's hand here, like I'm shaking it. And I'm going to come just above the medial epicondyle, about 2 to 3 centimeters. And I'm just going to go in between the biceps muscle and the triceps. Feeling for it. Which is good. We'll do it on the other side as well. So then next we'll do Allen's test, the special test. So I'll have you raise your arm up like this, and I'll have you start making a fist, doing it repetitively. We want to get that blood out of his hand. Do it for a couple seconds here. Good, I'll have you keep that fist on. I'm going to close off the brachial and ulnar artery. I'll have you open your fist for me, and then I'm going to release the ulnar. And we'll watch the blood flush back into his blanched hand. Good. We'll have you do it one more time. And then we'll do the radial artery this time. Okay, good. Keep that fist. Here, open your hand for me. And then release this side. And you can see it fill back up. Good. Now we'll move on to lower extremity. So I'll have you lay face down on the table, or on your back, sorry. Then can I have you roll your shorts up, the bottom of your shorts as high as you can get them? Sure. Perfect. All right, so here again, much like the upper extremity, I'm looking for, looking at the skin, looking for any discoloration, also looking for any scars, lesions, any swelling or edema of the legs. And then I'm going to do temperature. So patient, I'm going to start on the upper part of your thighs and work down to your legs. Is that okay?
Yeah.
All right. I'll use the backs of my hands here. Start lateral, work my way down, feeling for any temperature differences between the two. Warmth or coldness. And we'll start medial here. Okay, good. Next, we'll do the pitting edema test. So I'll perform this bilaterally, but I'll just do it on this one side so you guys can see it. I'm going to start on the dorsum of the foot here. I'm just going to push down for about 5 seconds. And release. We're looking for any indentation here. That does not occur there, so that's good. And then we'll do the, just behind the medial malleolus here. 5 seconds. No indentation, good. And then on the shin. And no indentation there, good. All right, next we'll do the skin, nail compression test on the big toe here. So again, we're just compressing this nail through this toe for a couple seconds and releasing. Looking for the blood to return back to the toe. Just kind of slow there, slowly coming back. Do the other side. That one's coming back, but it's slow, much like the other one. So then next, we will do the pulses. So first, we'll start with the Dorsalis pedis pulse. So I'm going to feel just lateral to the tendon of the extensor pollicis here, pollicis. Extensor hallucis, sorry, not pollicis. Good. I'll do this side as well. And if they're similar, checking rate, rhythm, amplitude again. I'm just going to do the tibial pulse, which is just behind the medial malleolus here. I'll do it on both sides. Good. And then the popliteal fossa. Feel for femoral pulse in here. Good, I can feel it. And the other leg. So then we'll come up to the front of the table here. And then patient, can I have you roll the tops of your shorts down just a little bit here? So I'm going to feel for the femoral pulse up here. Good. And then since I'm up here, I can also check for hernia. So I'm going to check for any lumps. Everything feels normal. And then I'm going to also check the lymph nodes, which are up here as well, for any nodules. Good. And keep it there. I'm just going to oscillate. Using the bell of my stethoscope here. Listening for any bruits. Everything seems normal there. Okay. And then you can come back up. Next we'll do the special tests. So we'll do Holman's. So I'll raise the leg here and I'm just going to dorsiflex the foot. And I'm going to squeeze the calf. Is there any pain with that?
No.
Patient? No? Okay, good. We'll do the other side.
Nope, no pain.
Okay. And then next we'll do the leg elevation test. So I'm going to pick their legs up here and rest on my leg. And then can you flutter your feet like you would be swimming in a pool? Good. So this is kind of like Allen's test. I just want to make sure that the blood flushes from their feet. Give it a couple seconds. Then I'm going to swing them over and we want to see that blood rush back into it. Lay him down, just slide over to the side of the table, good. You can already see that it's coming back into his feet, which is very good. All right, and then lastly, we will do the venous tap test. So can I have you stand on the table?
Sure.
Just make it a little easier. Careful not to fall. Good, good. I'll have you roll your shorts up again if you can. Good. So I'm going to place one hand in the medial side of the thigh here by the knee. And I'll take my other hand, I'm just going to tap just below the inguinal ligament on the medial part of the thigh. And I'm feeling for any pulsations down on my inferior part of my hand here, which I do not. And we'll do the other side. Medial part of the knee, tapping medial part of the thigh. Looking for pulsations,